The heroin problem in Louisville is pretty drastic.
Touching the lives of everybody throughout the community, all walks of life.
Oftentimes police officers are the first ones who get to the scene.
You're going to find somebody that's unconscious. Their skin color could be anything from normal to blue.
When somebody's in a state of crisis like that, it's very important that they get help as soon as they can. You know, just a few moments, a few minutes, a few seconds can be the difference between life and death for people.
Making sure that our officers have all the tools they need to do the job is critical.
Instead of just giving them a syringe of the Naloxone medication, we decided to come up with these overdose response kits.
Inside we have 5 doses of Narcan or Naloxone. Better advantage of using Narcan nasally. It takes a little bit longer for the medication to be absorbed, and they're slowly woken up. They're not more apt to come up, swinging or being aggressive or agitated.
Some officers have been resistant to this whole idea. I mean, here you have someone who made a conscious choice to stick a needle in their arm. It's a hard sell, but at the end of the day, we're still trying to save a life, and that's what we came to this job to do, to try to save people and to try to help people with their problems.
We have 2 full-time health and safety officers and 6 part-time health and safety officers. They've spent a lot of time getting in front of officers, selling the program, letting them know, how important it is.
From Lieutenant Shy to Officer Boswell and Officer Velton, their passion in getting this done, their passion in doing the training was unbelievable.
We haven't had a class that we've taught yet where at least one officer hasn't raised their hand and shared a story. They have a sibling or they have a cousin or a person, a close friend that are on the way back from it or have died from it. I'm glad that we can get on board with this and do something positive for our community.
The first deployment of the medicine out on the streets we had was December 12th, and I nominated them in early April, and that was already 120 lives saved. In my experience, there's been nothing we've done in policing that has had such a dramatic effect on saving lives in such a short period. The fact that you can save them, the fact that you can help them, the fact that they're breathing another day because you were there, that feels good for the officers, that feels good for everybody involved.
If we can change one person's outlook on their addiction to where they get help and no longer suffer from that addiction, then we're doing good for the community.
I'm very, very proud of our health and safety team. This father said, thanks to LMPD and what they were able to do, I'm working to get my son into treatment as opposed to planning his funeral. And that was very powerful to me.